Welcome to a deep dive with D.Rob Fitness, where we help you train smarter, optimize your performance, and create your fitness blueprint. Today, we're diving into something new with our Learn series, and it's something that I think a lot of fitness world could learn a lot about: defensive versus offensive care. When something hurts, many people's first instinct is to try and make the pain go away. Maybe that's medication, massage, adjustments, stretching, dry needling, and the list goes on and on and on. But what happens when that pain goes away? Are we actually making the body more capable of handling the things that caused the problems in the first place? That's where the ideal of offensive versus defensive care comes in, which brings us to today's guest. Today, I am joined by Dr. Tyler Panko to break down what these two approaches mean and how we can start thinking beyond simply feeling better to actually becoming more resilient. So let's get ready to take a deep dive with Tyler. So welcome to the show.
Thank you for having me. It's awesome to be here.
Yes. I'm really excited because you are a fellow expert, and I have a lot of respect for you and what you know and what you can bring to the table and really educate people about this subject. So why don't you take a minute or two and just kind of let people know why you are the expert? This is a time for you to kind of, I like to say, talk your shit. Just let people know if they're down you or they're just like, who is this guy with this big beard?
Yeah.
Let them know why you're the man.
Just to explain my quick background. So I got my start in physical therapy actually in undergrad. And I always knew I wanted to be in healthcare in some realm, and I always knew that I wanted to be within some type of movement realm. I started in athletic training as my degree in undergrad and quickly transitioned out of that because I knew that there was not much respect in that field. There are some high level ones that are respected, but it's very hard to gain respect, and you're working long hours. You don't get paid very much, and you don't get treated very well. So I moved on from that, and I got my start in physical therapy, and that's where I just got this whole question when I was young. I was probably 19 or 20, and working in this field, it was right next to a spinal hospital in Lincoln, Nebraska. And I started to notice that every single patient was getting treated the same. They would come in, they would get heat on their back, they would get some stem, they would maybe get some scraping. You can call it, most people know it as the E-stem. And yes, some people would get better, their pain would go down, but I just noticed that we'd see that patient just come back and come back. They would never get long-term improvement. And I just always thought, everybody moves a little bit differently and everybody has these different goals. Why is everybody getting the same treatment? And so that's where I started this age-old question of okay, what is true healthcare and how can we be able to increase the standard of care within the United States? And I'll go on that is that the United States is world-class and probably the best at acute care in the world. If you need immediate surgery, you come to the United States. So many people do. We're world-class. But the problem is that we are almost near the bottom of treating chronic conditions across the world, off of the more wealthier nations, we're near the bottom of being able to. Okay, what's going on? And so that's where I went, and I went into chiropractic school. And I will say, I stand on the shoulder of giants. I got very lucky that I got some very, very smart mentors that guided me along the way. And I took a lot of education while I was in school of traveling 2 to 3 times a month, going to different seminars and stuff, because I was just on this quest to learn as much as I could and getting different certifications, getting a strength and conditioning certification, just learning so much that I could about movement that when I got out of school, I wanted to be ready to go. And I continue on that. I'm a lifelong learner. I feel like I'm never going to be able to learn enough. And it's just a constant chase of just wanting to learn a little bit more so that I can be able to help the patient in front of me. And so I've failed a lot, and I've learned a lot from my failures. And I think that's an important thing, is to reflect and know, okay, how do I change this, and how do I make it more simple for the patient to be able to understand in front of me and not make it like an analogy I give is if you give a patient their MRI report, it looks like it's like some foreign language, right?
Yes.
Like I want everything in their healthcare for them to be able to understand, like, why are we working on this? And they understand, so more towards their goal.
Nice. Okay, so I'm sold already. So it just proving that you're the expert, and like I said, sold. So let's go into our first segment where we're just going to be kind of like painting the foundation of what we're going to be talking about today. So when people who are not familiar with the term defensive and offensive care, in just kind of a broad, simple way, because we're going to talk about each one specifically as the podcast goes on, how would you kind of explain it to them?
Yeah. So defensive care, and I'm not saying that these things are bad. It's just if that's the only way you're approaching your healthcare, commonly we get in this doom loop. And so the pain comes back, and then you're going back to the same approach, and you get a little bit of relief for a couple days to maybe a week. You see, I'm sure everybody knows somebody like this, or this might be yourself, where
yes, call them out, put them on blast.
Like it's and you mentioned it. It's the dry needling, it's the adjustment, it's the medications, it's the injections, it's even the surgeries, it's the massage. Those things are great. They can do a lot of good if you're in a lot of pain. And it can be good, especially even if you're an athlete and like, hey, I need to be on the field tomorrow. Like, it can be awesome to be able to make sure that like you're getting on the field. And also it can be a great speed boost. But it is just a kind of speed boost to healing. It's not actually doing anything to the actual healing long term. So the defensive care is just, okay, how do we calm down a little bit of inflammation? But it's really doing. Like, what is creating the inflammation? What is the quote unquote root cause? And there's never just one root cause, but what is the actual thing that is causing this inflammation to pop up, which can be I'll go into in the offensive type care, is what is actually causing that. So within defensive care, it's how do we get out of this rut of just trying to cover up or Band-Aid the pain or the dysfunction that you have, and actually get at, okay, how do I take care of this long term so that this is not my identity, right? And I'll get into that in the offensive care, but like, I never want somebody to get into like, oh, I'm just somebody that always has this quote unquote pain, or I'm somebody that just always has this diagnosis, and I just have to play whack-a-mole, or I have to play defense against this my entire life.
Okay. So why do you feel like people just naturally gravitate towards defensive care?
Yeah. Well, I think that's just how our healthcare system is set up. It's right now, most people, and I think this is changing fairly fast, and over the last 5 years, I would say this has changed, is you go to a primary care doctor, and they are the director. They say what is going on and where you need to go. So they'll say, oh, you need to go do physical therapy, or you need to go get an orthopedic consult, you need to get an injection, or here's this pain medication, or maybe a surgical consult on that. And so we get in this where we want to alleviate pain as fast as possible without taking a more eagle's eye view, as I say. It's like, hey, let's just take a step back for a second and look at your lifestyle and look at what is leading up into what is going on through here, especially a chronic condition. Acute stuff, like I said, yes, we have to act fast. If you have a staph infection, or if you have a broken bone, we need to act fast so that we can create that healing pattern. That's different. But if we're having a chronic injury pop up, or it's recurring, hey, can we take a step back for a second and just ask some questions? And what's your lifestyle like on different areas, and what could be ultimately leading to why you're experiencing this chronic condition?
Okay. So would you almost simplifying it, would you say defensive care is kind of protecting yourself?
Exactly.
And offensive care is kind of making yourself harder to break?
Yes, exactly. Yeah. It is. It's It's the best defense in the world. You're just trying so hard to prevent them from the inflammation from coming back, which is great. But if we're only doing that, then we're never getting on to just the fun side of stuff, which is what you do, right? I feel like that is the ultimate offensive care, is just guiding people to having fun with movement again. and enjoying their life, or going for a trip and with their family and going for a hike. That's offense. Like that's enjoying your life. You're not thinking about your body. You're feeling like whatever is with your family or whatever is in the outdoors. You're not thinking about like, oh, I got to step this way or I got to protect my back. That's offense. And like, that's beautiful. And like the same thing within your sessions, you're not having to like always work around a different injury. You're just guiding their movement to get them stronger and more resilient or a better cardiovascular system, whatever it is, and whatever their goal is.
Okay, nice. Okay, so let's go into a little bit more depth about our defensive care with our second segment. So, what are some of the most common things that people use when they're hurting?
Yeah, so I'll probably say the number one is stretching. The common question I get is, what stretch can I do for insert this pain point? What if they have low back pain? Like, what is a stretch I can do for my back or my hips, right? And it's not that is a bad question. It's just like, okay, like, is that your only thing that you're going to? Like, what is ultimately going on within your low back and within your lifestyle that is causing that to be a pain point? What I tell people is pain is just an alarm system. And the alarm system, sometimes if it's chronic, can be somewhat like it's getting tripped too fast. So imagine that maybe it's just I had this analogy that came up like the other week is if you had like an alarm system for your house, obviously it's trying to keep out an intruder. It's great if it does keep out an intruder, but sometimes people have such a sensitive alarm system that's getting tripped, similar to if somebody just stepped in your yard. It's tripping that alarm system. It's still pain, but it's so sensitive that sometimes we have to work around of like different things within your lifestyle. So we're not just getting your nervous system. And this is something Kelsey, I thought, did a great job of reiterating time and time after again, is a lot about your body is going back into your nervous system, feeling safe and not feeling protected all the time. And that's what I'm kind of talking about within pain. And so within defensive care, like we want to make sure that we're making your body feeling more safe and not feeling just like it's feeling protected all the time.
Okay. Because I know from not only working with you, but like going to a few of like your workshop seminars that a lot of times too, even going beyond with the stretching is, and you can elaborate on it because you're obviously the expert.
Yeah.
But a lot of times when we're feeling a certain pain, like let's say we're having a knee issue or a back issue, that sometimes it's not like that's the response, but there's actually something going on mechanically something else going on mechanically that is showing up that's showing as the pain, but it maybe is not initiating from there.
Yeah. And like to simplify that is like underworking versus overworking, which Kelsey talked about too, is that like within stretching, yes, it feels great for a little bit, but how long does that usually last? So if you did say a hamstring stretch, which most people have done, is it feels great in the moment and you feel like, oh, okay, I feel a little bit looser. But usually a few hours later or the next day, you're right back in the same spot. There's no more, you don't have any more mobility or anything. So it's not actually changing anything. It just feels good in that moment. So we have to ask the question, okay, why is that hamstring feel tight? Why does that hip feel tight? Why does that low back feel tight? Because usually that is usually the overworking area that you're stretching. And we're not actually getting at, okay, what is the area that is not doing the job that it needs to do, similar to the analogy that Kelsey gave with the bike chain. That's a beautiful analogy of like, okay, these two spots could be welded together and that might work for a little bit, but there is a point when that's going to start to break down and you're not going to be able to ride that bike anymore, or it's just going to explode. Like whatever it is, that bike chain is going to explode. It's a beautiful analogy. And so we want that bike chain to be able to be like smoothly moving. Every link needs to be able to be moving. And that's the whole body from foot to head. We have to look at, okay, what is not working within the body?
Okay. Because us as humans, and especially because you work with quite a few athletes as well.
Yes.
We can, and you worked with me, probably one of your top athletes, but but we can get really good with managing the pain without actually fixing our physical capabilities in actually addressing the problem.
Yeah.
And so,
yeah, and that going within athletes, I think a great one is taping. So somebody has an ankle injury in season. What do? They just tape it up and like they hope for the best. And they might go and they might get some stretches. They might do some calf raises or something like that. And they're in season, they're just trying to protect it as much as possible. But we don't ask, okay, what is ultimately going on here so I can make sure that this ankle is getting stronger, is being able to integrate back into the sport that I'm doing at best so it can be able to hold up.
Okay, so talked a little bit about defensive care. So with offensive care, what does that look like?
Yeah. So within offensive care, I think it's asking about their entire lifestyle. And also, I think it's about what do you ultimately want to get out of the care or your body you're seeking. So I'll give you, with a personal trainer, like if you have an initial client that comes in, you're always asking about their goals. And they could say, well, I want to lose weight. It's like, okay, like it's a good start. How much weight do you want to lose? Why do you want to lose that weight? And so you're going more towards the internal, like, well, I want to lose weight because like I want to be a better example for my kids, or I want to show my kids what a healthy body looks like. Okay, that's great. Awesome. Then you can get into specifics. Same thing with building muscle or getting stronger. Whatever their more internal desire. Well, I want to be strong so that I had a beautiful one a couple of months ago. He's like, well, I want to be strong because I have a kid with cerebral palsy and I always want to be able to carry him when I can. I was like, okay, that's beautiful. So it's more towards that internal. I'm always asking, like, what do you want out of your care? And it's not, hey, I want to have less pain. It's like, no, we need to tie this to something bigger. And so that's where the offense comes in. What specifically do you need out of your care in order to make sure your body feels resilient and strong? And that's different for everybody. Some people, it's like, well, I want to be able to make sure when I go on trips with my family, I can walk all that I want to be able. I can do all the hiking, and I want to feel strong with that. And I want to be able to lift my own luggage when I'm older. All those type of things. It's different for an athlete. Obviously, an athlete, it's like, well, I want to improve my performance in this, whatever it is. But we want to be specific on what you need to get out of your care for it to be successful. And that is not just like decreased pain. Yes, I know that's part of it. But typically when we tie it to something higher, then the pain and those symptoms naturally just start to go away when we start to focus on your function and what it's ultimately tied to.
Okay. Yes. So that is really good. And I really like how you have that approach of, once again, just tying it in. And that's something that even once when I have worked with you, is that you go beyond just the simple fix. Because for me, in my athletic mindset, I'm just like, hey, I love all this. Like, can you just fix me? I need to go play rugby and stuff. And you being like, you had to literally kind of fight me a little bit for it because I'm a little bit stubborn. But you had to, and I love that you did that, because it actually was like, okay, yes, we can solve this problem. I can get you out onto the field. Yeah. But we also need to address what is going on and how we can keep this from happening, so that you're not having to come and see me every week, and you can function on your own and you can do these little side things to get better. And so that's really dope in that you have that approach, because I've worked with other people who don't have that same approach.
Yeah, and there's a time and place for it. If you have a first-time injury, that's perfect time for defensive care, right? Just make sure you get back onto the healing side of things and guide through that. But if this is more of a reoccurring thing, then we need to take a deeper dive and look into that. And the analogy I also give with that is kind of like a financial advisor. If your financial advisor is making you no money or is losing you money, you're going to ask questions, or you're going to fire that financial advisor. And I think we need to start taking that same approach in healthcare. Is you need to start asking questions. Okay, why have I been on this medication for 15 years? Is there something else I could be working on? Or why am I still experiencing these symptoms? Like, don't just say, oh, keep doing it. Like, you got to start asking questions and taking ownership of your health care. And that goes for any type of health that you're seeking out.
Okay. So what are we trying to teach the body when we're doing like offensive care?
Yeah. So we break it down into 5 different categories. Obviously, like we're movement specialists. That's what we dive into. And there's different aspects of, looking at your body as a whole and seeing how you move. And so what we tell people is that movement never lies. And that goes in through the different things of like being able to evaluate the musculoskeletal system. We have your symptoms, we have your MRI, X-ray, your CT scan, but sometimes those things can lie. The analogy I give is that with disc herniations, there's a lot of people walking around with a disc herniation, they have zero idea. They have zero pain, they're functioning just fine. And then there's some people that obviously have pain with the disc herniation. So that does not say that that is your pain generator, or that's going to be something that you have to deal with a long time. Those things do heal, but movement is never going to lie. Like how you move, how you feel stable, does it look safe? Are you guarding? Are you tightening up? It never lies. So we're looking at that from a lens to see, okay, how can we make the body feel more safe and how can we make it move more efficiently? And then from then nervous system and breathing. Kelsey brought that up. That is a big aspect of our practice. And the reason that is that I give people, like I ask them, like, do you commonly feel wired and tired, or do you feel like groggy and kind of like a stray dog? And so there's different things within that of like, how do we have to work within the nervous system from many different lenses to make sure that it feels safe and not wanting to protect all the time. Sleep and rhythm. Do you have troubles with sleep? Do you have a natural rhythm within? Because typically humans, we're habitual creatures. And so we want that to be, this is the time I work out. This is the time I sleep. This is the time I eat. This is the time I go to work. Like we have natural rhythms that we want to be fairly consistent with, because that's where we start to notice that the body gets in a nice little rhythm and they become consistent and they're showing up for like your workouts at the same time and they're starting to make progress. You probably start to notice that when they're hitting their eating, they're hitting their sleep, when they're hitting their workouts, they start to feel better. They start to make progress. Chemistry. This is like how do you react to foods? How do you react to supplements and those different types of things? We're looking at that. And then belief and meaning. So belief and meaning is, do you have a diagnosis that is part of your identity? Do you constantly fear having a tweak or an injury? Do you feel unstable within your own body? Do you actually feel safe within your own body, or are you always like feeling like you have to protect? Those different types of things. Do you have a community that you can work out with, or at least have like different conversations with? So there's always different things that we want to be able to work on, and like where we're trying to like tie people into their care. But within that, we have a quiz that we do and we score on each of those categories. So what we look within that is, yes, we're always going to be working on the movement piece, because that's what they're presenting with, is usually a performance-based issue. I have pain and I can't do this. So there's a performance issue within movement. So we have to work on that piece. But within those others, like what is like just going off the charts? And there's usually one that's higher. And it's like, okay, we can work on the movement piece, but like we need to spend some time on working on this. And then once we can get that into like a great level, then, okay, what else is popping off and what can we work on there? So it's not working on everything at the same time. Maybe some is just going into like a little maintenance mode, but what is the 1 or 2 pillars that we can work on that's going to make a huge impact on your overall life? And then, okay, now let's get some education on something else to make sure we can optimize.
Yes, and it's crazy because as somebody who came in and we worked when I was doing my squats, and we were trying to figure out some things that were going wrong, and because I was kind of one of those people who, even though we're being honest, this trainer knows my stuff, but didn't necessarily put a huge emphasis into like knowing all these different things. And I remember you were talking to me about my breathing, and I was like, and breathing and bracing, and I'm like, well, yeah, I know I have my bell and I do, but you were able to really get me to really hone in and to focus in on that. And that improved not only my lifting, but it also improved me with not having as much pain and like potentially injuring myself and everything. And it's like something so small that you, like I said, I feel like a lot of people wouldn't even think about, oh yeah, you're breathing, you're bracing. I mean, like, you know it, but to really hone in on it as that could be the trouble area that is causing these other problems, you don't always put two and two together. And I remember having that experience and being like with you and being like, oh wow, like, oh, not only does he know what he's talking about, but it goes to show you how all these things come together, and you need all of these working together to be functioning at your best, at your highest level.
Yes. Yeah. And so it's very similar. Like Kelsey was talking about like the myofascial release. And if you go too hard into like a muscle, like commonly you start guarding, right? Or it's not going to be as effective. And then when you go back into it, like your brain remembers that, and it's like, well, this sucked. So you're not getting the effect you think of, and it's commonly like you tighten more up. And the same thing within movement. You've probably seen this, is if you give somebody like a squat, you see them think about it for a little bit, and they tense up or they guard. And so like they're just kind of reiterating this pattern of like commonly just tensing up way too much before they do a movement, and it doesn't feel smooth, and it doesn't feel just like a natural human movement. So that's something that we want, okay, how can I be able to make this movement just feel very natural for them?
So kind of continuing with that, if somebody is working out fairly regularly, does that automatically mean that they're doing offensive care?
No. No, because I mean, like, cause you can get into like the weeds with that, and like into like if they're just working out very regularly. I see this all the time within that people of they're either, we give it the analogy of like the Goggins approach of like they're just pushing through their pain. It's like, well, you know, it's not that bad yet. I'm just kind of pushing through. I'm kind of just ignoring it. It's like, okay, all right. Well, like that might, I don't know how long that's going to go, like that approach, but there's going to be a point where your body just says no, and it's going to tell you to stop. And it's going to be too much pain for you to be able to handle. So even within like working out regularly, you're going to see something pop up. And like, again, like there is people that are obviously they're working out regularly and they feel great. But it doesn't mean that you are like on the offensive side of things if you're ignoring all the other things within your life. Like if your sleep is only 4 hours a night, or you have a consistent issue with sleep, or if your nervous system is always in such a high gear that you can't be able to ramp down. And there's many different things within that you could not be on the offensive side of things if you're just working out consistently.
Okay, so basically you're saying that it's not just the working out, but it's like all of the pillars that we kind of talked about before, and having them working efficiently and effectively in order for it to really be on the offensive care.
Exactly. Yes.
Okay.
Yes.
Okay. I see what you're putting down.
Yes.
So how do you kind of determine what a person's body like actually needs?
I think that's usually that they're going to answer that question for me by me asking them questions. So what I typically think of is that when I'm doing my history and my first initial consult with a patient, like I can know about pretty much 80% confidence interval where I need to be able to take this case by just asking them questions. They're going to tell me what they need. And that's based on like what they've experienced into the past and like what's helped them, but also looking at pattern recognition of, okay, what type of job do they have? What previous injuries did they have? That's a huge tip off. Like, have they had previous injuries? If they have low back pain, but they've had a previous right knee injury, or they have a previous right ankle injury, okay, I need to go investigate that area, right, to see if that is causing dysfunction going up the chain. What is their relationship with fitness? Like, what is it like? Are they consistent? Are they inconsistent? Do they feel pain after a workout? Do they feel pain in a workout? All these different types of things gives me a clue of where I need to start with a patient first. And that gives me a good, and then the extra 20% is then the actual assessment of watching them move and seeing where they're protecting. Then that's the other part of like, okay, here's the full pattern and where I need to be able to go with it.
Okay. So yeah. Okay. So all that information just kind of helps to lead you on how you can help people. It
Yes.
just
Yeah.
okay. So if somebody is saying like, can you train around an injury without completely stopping? Because I know for myself, I have a lot of clients who will be like, "Oh, I hurt my back." And obviously, there's different severities to it and whatnot. But then they'll be like, "Oh, I can't work out, or I shouldn't do anything." Is that like the right mindset to have, or?
Yeah, I love that question. And I am always the proponent, do what you can. So if you have a low back injury, can you load your upper body? Yeah, most people can. You can still do some type of, even if it's just machine work or some type of bench press, or even if it's curls and triceps, like get something in, because they've done studies of like if you break your right leg, for instance, and you still go in and train your left leg, they've noticed that you're able to keep some muscle mass on that same side by just working the other leg. So, which is fascinating, right? And so it's always the approach of do what you can, no matter what injury you have. And there are harder injuries to work around, but getting into the gym and being able to do at least what you can keeps your body moving, and it promotes blood flow, and it can have this cross-sectional effect where it keeps like muscle mass on that same sides and promotes faster healing on the side that you're trying to work around.
Yeah, because I always tell clients, especially when I'm like working and they have like some kind of injury, and we kind of we obviously work around it. And just like you're saying, people know what feels good and what feels bad for the body, and what is kind of a little soreness or and what is actual pain. And most of the time after they work out, they're like, oh, I feel better, or I feel more loose, or I feel like, and so it's just crazy. So I always like try to tell people, like, obviously don't push it if if you're really feeling pain, but there's something to it about continuing to work around it, and that can actually make it feel better, or so
yeah, and I think that's important, and that's like your job, like especially like that's what regression is for. So let's say they have pain during a squat. Well, okay, like let's just lower the weights initially and see, do they do better? Perfect. If still having struggle, okay, let's go to a different type of squat. Maybe a squat to a box. Okay, I feel pretty good with this. Okay, start there. Or do I still experience symptoms? Okay, let's go even to like the ground and do some type of like squat pattern, like a dead bug on the ground. Like, there are always ways that you can be able to regress it. Or if that's still not working, okay, let's just move on to a different pattern and see if we can start just working that pattern within it. And there's different approaches for different people. If there's people that have been in chronic pain for a long time, sometimes I'm going to have to work within and be able to like say like, hey, a little bit of pain is fine, right? And just guide them. Like we use a traffic light system for them of like green, yellow, red. Like, okay, here's one to notice, like, hey, you're pushing too far. Here's one to know, like, to take note. And here's one, okay, you're safe. Like, you're going to be fine. And that way it's like, because like just rest it doesn't work. We've seen time and time again, it's like, okay, you feel better. And then as soon as you go back into like challenging it again, it goes right back to the same type of pain you have. So we know we have to challenge it in some ways. It's just having the proper guidance and the proper plan to be able to do around that.
All right. I'm going to clip that and send that to my sister, who's an online client and who was actually on the podcast. I'm going to clip that part because we're always kind of battling about that. So I feel like the expert said this, so you won't listen to me, but you
got to hear from somebody else. That's my family.
So let's go into some real world examples. And so I'm just going to kind of give you little scenarios, and you just kind of, and obviously you would be more detailed, you have much more information, but just kind of a broad stroke of kind of your approach to it. So let's say that you have a client who is having a low back pain, and maybe this client hosts a podcast and is a rugby player, a model, a personal trainer, just a outstanding guy, but every few months he has reoccurring low back pain, and he goes and gets adjusted and it feels better and goes back to normal, but then it'll come back after a few weeks. what might defensive care and offensive care look like in that situation?
So defensive care is like currently what you're doing. So you might do some stretching before your workout to help loosen up. And then you might go get adjusted. You might go get a massage, those types of things, because it helps it feel better for a little bit. Mm-hmm. But it's not getting at the actual pattern, because you're still experiencing like a flare up at once a month or whatever it is. And so the offensive care is then going on, okay, let's take a wider lens view of what actually is going on, and just watching you move. So if it's like, I commonly feel like I get this flare up during or after I do a snatch or a squat. Okay, well, let's just look at the actual pattern that's causing that and see where are we breaking down. And so that could look like, okay, well, I noticed that we're not getting, and usually we're looking like first off above and below. So if it's low back, I'm going to first look at the hips, the pelvis, and then also the mid back, because those are right next to that area. And so those areas need to be able to be moving efficiently. Otherwise, commonly the low back is going to make up for loss of movement or loss of stability that's not happening in another area. So we look at those areas. Okay, for you, maybe we need to get some more mid-back extension or mid-back rotation through there. And we start training that and giving you stuff that you're doing as your homework every single day or a couple times a week that you can add into your warm-up, or during your actual workout, adding a workout piece that opens up your mid-back rotation, your extension. We test and retest. Oh, actually, like this is feeling a lot better. Okay, we're on the right track. And during that, then we say, okay, how can we keep you training? So maybe we regress the pattern a little bit. We make it easier. We reduce the weight, reduce the reps, whatever it is, reduce the pattern that's similar so that you can keep training that pattern that is the right pattern and is doing well. And then sometimes it's just looking at, oh, actually you need this different cue in order to make that pattern be expressed well, right? And so the efficiency of the pattern so that the task looks better.
Okay. So let's go into another scenario, and let's say we have a person who is a runner who has been documenting their running and, putting about 20 miles a week. So, they're a hybrid athlete. So, they're good at everything. And so, but they're having some knee issues. What might defensive and offensive care look like in that situation?
Yeah, common with runners, I love working with runners. Knee pain. So if we're looking at knee pain, I tell people right off is the knee is the redheaded stepchild between an ankle and a hip that have to do a lot of work. They're both rotational joints within the ankle and the hip, and so they have to be able to move, and they also have to be like strong for the knee to be able to hold up. In common within strength, within runners, not everybody, but they commonly neglect the strength training that they need to be able to do. And so based on whatever type of runner they are, we're looking at anywhere from 5 to 10 times the amount of force, body weight that is going through your leg every single time that you hit the ground. You have to be able to manage those forces. And so for them, I'm looking at, okay, do you have the proper mobility first through your hip and through your ankle in order to express the proper running range of running motion? If that's clear, okay, then I'm looking at strength. Do you have the capacity to be able to handle that? And within that, I'm looking at the calves, I'm looking at the quads, I'm looking at the glutes, the hamstrings. Do we have the capacity and the endurance to be able to handle that? And commonly, I'm gonna see some clear holes. Like, okay, this is not doing the work that it needs to be able to do. Especially I feel like calves get neglected a lot of times. You have to be the calf has to be super strong, and it's such an important piece within running that it's an easy thing to be able to add capacity in. Or maybe it is like the quad just needs to have a little bit more capacity based on them. So it's looking at a broader based lens, and then also just giving them education on okay, well, what is your running program looking like? Are all your runs just full go? Do you have different intensities within your runs so that like you're giving your body the proper recovery? And so do you add some cross training in if it's a bunch of miles, because that will take some load off your body. There's many different aspects within it, within running, but I love working with runners and just seeing, okay, how can we make your programming as optimized as possible towards their goal or whatever race they're training for?
Okay, that's music to my ears. And so for the last one, it's just like an everyday person. And so they're not necessarily an athlete, but they want to be able to do stuff like play with their kids, hiking, just be able to move, golf, just be able to move around. What does offensive care, defensive care look like for them?
Yeah, and this is more what I'm going towards. It's not a sexy answer for most of them because my mind goes to, like, with just a normal person is probably somebody that has a desk job. And like, yes, there are things within the 5 pillars I talked about within movement, the nervous system, sleep rhythm, the chemistry, the belief and meaning. But commonly the non-sexy answer within the movement is like, hey, like, I just need you to get to move more throughout the day. So I'll say that they've done studies of, let's say, a desk worker that maybe they are consistently working out. Like you said, the analogy of the person, like if they're just consistently working out, are they playing offensive? They've done studies of like somebody that just sits at a desk for 6 to 8 hours and then they go work out after work versus somebody that is maybe they do landscaping. They don't work out, but they move all throughout the day. Guess which one is healthier? The landscaper, because he's moving more throughout the day. And so I emphasize that with people that feel like, well, I'm doing all the things I can, I'm working out. I'm like, well, we're missing this huge piece like throughout your day where you're just sitting at a desk from 6 to 8 hours. And the only time you get up is to go to the bathroom or to go eat lunch or to go get coffee or water. We need to be able to increase that because it's like, you're just sitting there passive all day long. And so your body adapts to that of just like sitting. Kelsey brought that up too. Like your body just adapts to the thing that it does the most. And so it's adapting that sitting pattern and you're just hanging on passive tissues. Your active tissues aren't working all day long. But then as soon as you get out of work, then you're like, okay, well, I'm just going to go ham on my active system when it's just been chilling out all day long. Yes, you can get away with that for, probably a long time, but a lot of times we see that go wrong where then you're asking to ramp up your active system so fast and then we get a tweak or an injury. So simple thing you can do. And I was listening to a guy the other week and he said we would do so much to our healthcare if people just walked for 5 to 10 minutes every single hour. And obviously people are like, wow, I got to do that. And it's like, well, okay, what if you took a 30-minute break every 3 hours and be like, oh, I got to do that. But it's just, okay, let's start with something easy. How about you do 5 to 10 air squats every hour? Something like that, just getting moving every hour will have such an impact on your health over time. And so that is something that I address with them is hey, this is not just about you buying a stand-up desk. This is about just giving your body more movement variability out throughout the day is going to be a large piece of this, along with the other things. Yes, we want to look at your overall movement, but I mean, it's not a sexy answer, but it's that has to happen.
And that is so funny because I was literally talking to one of my clients about something similar. I was like, man, I just wish that everybody that had to work desk jobs, even if it was just in the middle of the day, just had to go out and walk and get for 30 minutes and go outside. And that would make people so much healthier.
Exactly.
It's just such a small thing. But it would really make such a big impact. So it's funny that you brought that
yeah,
up.
No, think about the people at Coke. If every mid-morning they had to go for a 30-minute walk, and then at lunch they had to move around a little bit, and then the afternoon the same thing. In the mid-afternoon they had to go for a 30-minute walk. Just doing that, we would make such a huge improvement on offensive care that it would be wild. But it's so simple that people just bypass it. It's that won't do anything. But that would make such a huge impact on people's health. But again, it's not a very like sexy answer.
No, and that's what, and especially when like first talking with clients and stuff, and I'm sure that you can relate. It's just like sometimes when you're having them do stuff, it's not the crazy like stuff that you see on TikTok or on social media. It's the simple things because they actually work, and we try to overcomplicate stuff, and we're trying to do all these crazy things when it's just like simple works.
Yeah, and like going back to like we're talking about like different like client profiles here. If I have somebody that's like coming in and they take this quiz and I'm asking them in their history and like everything is off the charts, well, the first thing I got to start with is the nervous system, and like I gotta like just get them walking, and I got to get them like their nervous system feels safe again. So what are they working on? Breathing, and they're like, it's so simple, and they're like, well. And I like prephrase them like, I know this is going to be like treating a rash. It's not fun. It's kind of boring, but this is like where we have to start. I can't give you like, hey, go to the gym 2 to 3 times a week. You probably already tried that and it either increased your pain or you didn't feel very good. So we got to start with something, and with like getting their something within breathing to get them to feel safe again and get their pain to calm down. And yes, I am giving them some things for pain, but like that's where we start. And then we can then slowly increase from there to the more fun things than the offensive things.
All right. Well, I'm going to give you kind of this is your opportunity. This is open-ended. So kind of what is a myth in either the defensive or offensive care that you would like to just set straight? And I know there's a lot, but what's like the big one, the one maybe you hear the most commonly, or the one that you see the most that you would like to set straight? Like, this is the time.
Yeah.
You're the expert and the doctor.
Yes. That I just need to stretch more. Number one. It's like, no, like I went back through it again. It's just like, okay, the common thing within that, it just feels good for a little bit. It's the same thing as if you took ibuprofen. It feels better for a little bit and then it comes right back. I'm not saying that it's bad. I'm saying if stretching feels good, you can do it, but it's not necessarily it's not making you any long-term improvement. And so that's a common thing I hear is like, well, I know I just need to stretch more. It's like, no, that's not the answer. I promise you that's not the answer. I think that's probably the biggest one.
Okay. So I have these next couple of things, and I want you to tell me would you classify them under defensive, offensive, both, or it depends.
Okay.
So a massage.
Depends. It depends what you're getting it for. So if you are getting it for just like pain relief time after time after time, that's defensive care. If you are in, I just like it because similar to like what Kelsey is talking about, like I am doing it to optimize my fascial system more and more to make it more hydrated and supple. I feel like we're going to continue to see within the research that is offensive care. We're going to continue to see that. But if we're just doing it like, hey, I just need this pain to feel better for a little bit, that's purely defensive. So it's about like what you're doing it for. If you're doing it to optimize your body, great. And if you're an athlete, it's like, I know when I go and get this, that like I am able to move better and I'm able to stay more recovered. Great. Awesome. But if it's purely for pain relief, defensive.
Okay. Adjustments.
I would say most of the time, defensive care, especially if you're having to go twice a week for the rest of your life. Like that is purely defensive care. It should never be like that. If you are just going like maybe like a few times a year because it feels good and you like it, I have no problem with that. And like, obviously, like I'm a chiropractor, I do use adjustments, especially in the beginning. And commonly what I tell people is like, when I'm in the beginning of care, I am having to do defensive strategies because I need to get your symptoms to go down. But like, we have to move beyond that. So if you're doing it in the beginning of care to help make sure your symptoms are going down, because like pain is definitely going to guard me from getting you towards the offensive side of things. But if that's the only thing you're doing, and then there's no shift in care, like, hey, can I be able to get out of the body mechanic things and get it more onto of like the self-empowerment things, like, hey, how can I take care of this myself? Like, or how can I be able to make sure that I'm optimizing my care? Then I feel like we're just hanging on to a defensive strategy.
Okay. We already know how you feel about stretching. So,
Yeah.
Strength training.
Strength training, that's always offensive care, always offensive. And I feel everybody should be at least strength training an hour and a half a week. And that could be 2 45-minute sessions or 3 sessions or 30 minutes is typically where everybody should be, at least. Can be more, but usually not less.
Okay, walking, running.
Walking is the best medicine. It's the best medicine in the whole world, and it's the most. It's like we just like we take it for granted. Like getting outside and walking, like we talked about, is, I mean, it's one of the best things you can ever do. Is it everything? No, but like it's probably like my number one. If I can just get people out and walking more, especially if you do have a sitting job, it's going to do so much for your health.
Okay, what about foam rolling?
Foam rolling, the intention matters. Intention matter. Like, what are you doing like for it? If you're just going in, so I'll give the analogy. If like you just go in and like, man, like my back is like just super locked up and tight, or my hamstrings are super locked up and tight. So you go up and you're scrolling on your phone. We see this in the gym all the time. We see this in the gym. You're just scrolling on your phone, and then you're kind of just rolling out your hamstring, and then you're like, well, okay, well, I'm going to go start doing squats. Like,
I feel very attacked.
there's no intention to it. And one thing like that does it, we don't realize that can open you up to more injury over time. So let's say that you can't touch your toes going into the gym. You do some foam rolling, and then you have all this more range of motion. Your body doesn't have ownership of that range of motion yet. So if you go and put a bunch of heavy weight on that and you don't know how to control that weight, what happens? Well, we could see that like you tweak your hamstring or you tweak your back. And we think, well, man, I just didn't have the greatest form on that. Well, what if we go back to the foam rolling right before that, and all you did was do that, and you didn't do anything after that to make sure that you're having ownership of the range of motion you just created.
Okay, so I'll make sure and let Kelsey know foam rolling is bad.
No. And I'm not saying it's like, I will say, okay, there's like, so intention does matter. If you are doing it to make like I said, like the fascia more supple, more hydrated, you have intention behind it. It's not, you're just going like pain is gain, but you're going soft and you're trying to like open it up, and you're doing it typically, in my mind, you're doing it in times outside of the gym. So maybe morning or night, maybe after your workout, to help optimize that wherever it is. Again, context matters within that. But if you're doing that and you're trying to open up areas that you struggle with, I think there's some amazing benefits that can help with that, and especially within chronic pain. But if you don't know what you're doing, or that it's just mindless, like it's usually to no effect.
Okay. So, if you could give someone listening one piece of advice that would immediately help them stop just managing their body and start building a more resilient one, what would that be?
I would say going for a walk at sunrise and for a walk at sunset. If you can do that.
Besides that, because because I know how we're going to be walking.
We're going to be walking.
Starting walking clubs.
Yeah.
And
okay.
Yeah.
So one piece of advice outside of what?
Outside of walking. Like
outside of walking.
Yes. See, I had to put you on the spot somehow because you were doing too well. So I had to wait for the last question and get you.
I think the belief and meaning aspect. I'm going to go to that. I think if you need to challenge pain management. So this is kind of the attack. I think pain management is one of the stupidest things in all of healthcare. Like, we're going to manage pain. Like, are we just going to manage a staph infection? Like, that sounds stupid, right? Sounds very stupid, right? But like, we got this now, is we're just going to manage your pain. It's like, how about we like look at your body? Like, that just like, it doesn't make any sense to me on that. And so if you are stuck in that rut, I want you to know for a fact that that is the wrong approach. And there are things that we need to be able to do. Is it going to take some work? It may take a long time? Yes. But you have to know that there is an approach where you can have freedom in your body and not have to feel like you're always having to work around your pain. And because like I see people that like they fear having to go to family events because they don't know how their back is going to react. They don't know how whatever their pain is going. They have to miss family events because of their pain. They can't go on the trip. They can't drive, like those type of things. And so if that is you and you are just constantly like, well, let's try this pain medication, or let's try this injection, or let's try this surgery. If you're in that approach and you've been doing that and it's not working, know there's a better approach to it. There's a different approach. I think that's probably the number one thing I want you to know, that you don't have to have insert diagnosis, a disc herniation or fibromyalgia or whatever it is. That doesn't have to be your identity for your entire life. Those things can heal. We just can't see them. That's the thing. If you see a cut in your forearm, we see that healing. But if we look at like a joint or a chronic issue, like let's say arthritis, we can't see it. So we just think it's always going to be there. It's like, well, okay, why is that arthritis happening? Why is that disc herniation happening? Can that heal? Yes, we've seen it happen. It's just like the approach that helps that happen.
Man, I am really glad I pushed back on.
I know,
on
yeah,
you,
right?
because that was a gem of an answer. So that was so good. So if people want to find more or learn more about you and your work and everything like that, like how can they find out more? Like, what's your contact information? Are you accepting clients? Like what?
Yes, yeah, we are accepting clients. I work at Oxoma. So Oxoma, we're, people always ask like what we are, but we can just like roll in like, yes, we are chiropractors by trade, but we've done the work and we have certifications and you name it, manual therapy, physical therapy, strength and conditioning. Like, Dr. Justice and I, Dr. Justice Kaufman, he's the other practitioner in the office as well. Golf, like different sports. So we try to have just a well-rounded toolbox, and we want to be able to use the right tools for the right people, but also just being able to make sure that like we're people for patients. And so if you go onto oxoma.com, we do a free consult, and we don't do that free consult just so that we can be able to sell you something. Like we truly mean that we want you to be in the right hands. So we're not for everybody. Like if somebody does have like a first time injury, probably not like our type of patient, because like we're taking a deep dive on stuff. But if you are the person that has had recurring injuries, or you're like, my body just feels off and like, I don't want this, and you're in your 20s or early 30s, and you're like, man, my body just feels older, and like I don't want it to continue to go in the wrong direction when I'm 40 and 50. Like those are our type of clients, athletes that feel like they are lacking performance in some way. Those type of patients are really cool for us. But we work a lot with the weekend warriors, the chronic pain people, and just people that the regular old folks that just want to be able to feel better and not have to be stuck in a loop is who we work with.
Awesome. Well, thank you for coming on today's episode and giving so much knowledge. I really knew that I wanted to have you as one of the early guests on my podcast, because I have such a deep respect for you and what you do. And before I even started to work with you, just when I first met you, you've always just been an outstanding guy and just top-notch quality. And so to have you on the podcast, giving your knowledge is just something I'm very thankful for, and for your work with me, because you've helped me out a lot. And not only with my physical pain that I was having with like some hip, back stuff and everything like that, but you actually helped me expand my knowledge base because you were one that like really breaks things down, and really for somebody like myself who knows the stuff and it's always good when people, because I've been to like chiropractors, I've been to other doctors before that they would just put a Band-Aid on it. They would kind of fix it, and that was working for a while, but we were never getting to the root of what was causing it. And so with working with you, you were able to really help me build up these muscles that I was missing out, stretching the way that I needed to, so that I have been fairly pain-free. I mean, I still play rugby, so there's always going to be stuff. Yeah. But I'm not having all these back issues that I was having before. And so I was able to continue to do something that was a passion of mine that I love to do, and a big thankful to you for helping me and helping guide me to not just fix the problem, but actually to look into, because like I said, when I first started, when I was even first coming to you, I was like, can you just fix it? I understand. I know there's more, just fix it. But you really broke it down and really helped me repair my body. And I'm always internally grateful for that.
Yeah. So. Yeah, and I appreciate you, and one of the big things that we talked about the belief and meaning piece, but we're huge on the community, and so that is the gyms and the trainers aspect I think is huge. And so I think one of the coolest things is when I get a text and the number one thing they say is hey, thank you so much for introducing me to so and so. And so I got one of these last week, and it was with the Phoenix Gym, and then also F3. F3 is a men's organization in town. Mm-hmm. Yeah. I think that's so huge. When we can get people in communities that fit them, that's the offense, because then they're in community with people, they're having fun, and that's what I really appreciate about you, is that you always yes, you want people to move and get stronger and lose weight, but you make things fun, and I think that is so cool. And I think that's where people, they look forward to come seeing you. And that's where the huge improvements come, I feel is when they're connecting in that way with their body and having fun. And because that's the way it should be. We should have fun with our bodies. And I feel we demonize our bodies so much that we should have a positive outlook on our bodies and what they can do. So I appreciate that. And we're always pushing towards where we can put people in the community and where they don't have to rely on us, and they can just have fun. And all these different things Wichita has, run clubs and rugby or whatever it is that fits them. If we can get them connecting to what they jive with, I think that is where the offensive takes place, because trainers, and I'll say this time and time again, trainers are the front lines of healthcare. If we can keep them in the front lines where they don't have to come see somebody like me, and they can be able to get stronger and lose weight and be able to mitigate, and then also you are getting them hands if they do need some more guidance, I think that's a bread and butter.
Yes, love that. Well, thanks for joining us for another episode of A Deep Dive with D.Rob Fitness Learn Edition. And make sure, if you enjoyed this, hit the subscribe button, leave a comment, leave a review, leave a star rating, do all of that stuff to really help keep this podcast going. And remember to keep training smarter, optimizing your performance, and creating your fitness blueprint.